Receiving medical results can often feel daunting, leaving you with many questions and perhaps a bit of anxiety about what comes next. You might be wondering, what exactly do these words and numbers mean for my health? Understanding your colposcopy biopsy results is a crucial step in managing your well-being. To understand your colposcopy biopsy results, you need to know the terms your doctor uses and what they signify for your health. Essentially, these results tell you if there are any abnormal cells on your cervix, how severe they are, and whether any further action is needed. A colposcopy allows your doctor to visually inspect your cervix more closely after an abnormal Pap test. If they see suspicious areas, they take small tissue samples, called biopsies. These samples are then examined under a microscope by a pathologist. The pathologist looks for changes in the cervical cells. The purpose of this process is to identify precancerous changes, known as dysplasia, or cervical intraepithelial neoplasia, often abbreviated as CIN, before they can potentially develop into cancer. They also check for inflammation or, in some cases, cancer itself. Each finding dictates a different course of action, which is why understanding the specific terminology is so important. When you receive your results, you might hear terms like normal, inflammation, or dysplasia. Normal or benign findings mean the cells are healthy. Inflammation indicates irritation but is typically not serious. Dysplasia or CIN means abnormal cells were found, but they are not yet cancerous. This dysplasia is graded as CIN1, CIN2, or CIN3, indicating mild, moderate, or severe changes respectively. CIN3 can also be called carcinoma in situ, meaning the most advanced precancerous stage where abnormal cells are confined to the surface of the cervix. Rarely, the biopsy might show invasive cancer, which means the abnormal cells have grown deeper into the cervical tissue. To fully grasp what your results mean, always schedule a detailed discussion with your healthcare provider. During this conversation, ask them to explain the specific terms in your report and what grade of dysplasia, if any, was identified. Inquire about the implications for your future health and what follow-up care or treatment options are recommended. Your doctor is your best resource for interpreting these complex medical findings in the context of your overall health history. Knowing the details from your colposcopy biopsy report empowers you to be an active participant in your healthcare journey. These biopsy results provide clear and precise information, allowing for targeted follow-up or treatment, rather than relying on general screenings alone. This precise information is critical for distinguishing between minor changes that might resolve on their own and more significant findings that requiring intervention. By understanding these results, you can confidently discuss your care plan and make informed decisions about protecting your cervical health and ensuring early intervention if needed.